Hi, everybody. Welcome back to our Center for Discovery and Discovery Mood and Anxiety Facebook Live series. We usually do for about 10 to 15 minutes on different topics for eating disorder recovery and for mental wellness. And today I'm excited because we have our first clinician outside of our treatment programs to give us a different perspective on mental wellness. And Kara, thank you for being here. Do you want to introduce yourself?
Sure. Thanks for having me. My name is Kohnen. I'm the clinical director at an outpatient practice in San Diego called Grow Through Life Counseling. We treat kids, teens, adults, and we have 4 locations with about 30 therapists throughout the county.
Okay, thank you. I don't know if you guys can tell, but Kara has one of those like soothing clinician voices. And I wanted her to do Facebook Live with us because I've heard her before and you do your own as well, right? You do some videos.
Yeah, I have a few videos.
Yeah, so she has a lot of information to give us. And the topic we're tackling today is a very popular topic these days. The title of it is The Efficacy of Telehealth for Mental Health, How People Are Still Benefiting Through Video Conference. Are you ready for your first question?
Sure.
Okay. How has the transition to telehealth been going at Grow Through Life Counseling?
Well, it was a shock, I think, to everybody in the middle of March. Prior to all that went on, we never even offered telehealth. We work with a lot of kids and teens. And I think just as clinicians, we love being in the room. We love taking care of people. And so it just really wasn't even on my radar. And then when we were faced with the decision of having to stop caring for people altogether or providing this alternative, we decided, hey, let's jump in and try it. And then I jumped into a lot of the research around efficacy around it. It really wasn't something on my radar. So March was really a big time where we were all growing and learning. And it turns out that the efficacy studies are there for individual counseling, that people can benefit even more so in certain cases from having access to care via telehealth. And it can be just as helpful in person as it is via video conferencing. So we're super grateful we have this opportunity to keep treating our patients.
Yeah, this is when technology is so valuable, when our world is ever changing.
Yes.
Second question, did you have patients who did not want to do telehealth?
We did. In fact, our first week, about half of our patients were like, no, thanks, we'll just wait until you're back in the office. And we felt like, yeah, we'd rather be back in the office too. That makes perfect sense. Also, that first week of March when shelter in place first came in, I think there was a lot of unknowns. There was a lot of fear and anxiety around what's happening and what's safe. So we totally understood that. And then after our first week in telehealth, we decided to start meeting as a staff to talk about the positives and negatives, the challenges, and then share ideas on interesting interventions we could do over video. And we found that some of the people who originally dropped out, once we realized, oh, wow, this is going to be a little bit longer than we thought, and we reconnected with them and asked, hey, would you like to give it a try? We're actually finding it's pretty effective. We had a lot of patients decide, you know what, let's do it. Let's give it a shot. And they're still benefiting from care. So I'm really grateful that people are willing to try something new or take that little bit of risk and see that potential benefit. And then we still do have patients that we're hoping do return to the office when we come back, and they're waiting for that opportunity. And we're hopeful that we can do that sooner rather than later.
Yeah. I mean, I've talked with other clinicians, and the best time to seek help is now, right? In this moment, no matter how, what it looks like.
Sure.
Yeah.
Yeah, and that's actually really scary for me, looking at all the increased calls to suicide hotlines and the increased, obviously, fear and anxiety we're experiencing as clinicians. And Melanie, you doing all this outreach, talking to all these therapists, we're experiencing it. We know that our patients and the community at large is experiencing it. And so we're really wanting to get the word out there that they can still benefit from telehealth and that they could be reaching out and could be doing that anytime. And then a lot of practices, ours included, are offering some discounts for frontline workers or people that are high risk or people that have had job reductions or job losses. Is we don't want finances to be a barrier. We want people to reach out to us. We want people to get the care. The care is available. And most therapists across the country, wherever people are providing some level of tele-intervention. And it's really important that people get help if they're having a whole lot of distress or support at this time. So we definitely want the word out there that therapists are available. They want to be treating people, they want to be helping people, and that there's benefit to being in care at this time, even over video conference or sometimes phone conference if the video stops working on us.
Yeah, I've seen that you guys have been providing discounts, and I think what a beautiful service to give our community. So thank you. And before I forget, I know we didn't discuss this here, but you have a support group, right? That you started for high school students?
We do. So one of the areas I've always loved, I have a heart for teenagers, and just the crushing loss of senior year, not being able to go to graduation, not being able to go to prom, senior night, all the things they looked forward to and saw all their peers do the three previous years. And then having those transition points of ending high school and going on into college and to what they're going to do in the rest of adulthood. These are all transitional opportunities and ceremonies that help kind of close that chapter of life out that they're going to miss out on. So class of 2020 is very, very, in terms of grief process right now, an area we're looking at as suffering a little bit more than maybe other populations or other ages. And we have decided to launch an online teen support group just particularly for seniors for the class of 2020. So we hope to get that started the first week of May, and we can have up to 8 teenagers in that group. And it'll be specifically a group around talking about what should be happening that's not happening for them right now, and hopefully a way to provide some termination emotionally to the end of high school so that they can transition successfully onto what they're going to do in the fall.
Oh, that's awesome. I'm so happy you're doing that. I can't imagine how they must feel. They'll be really special, though. They'll find their special through this process, I'm sure.
Yeah.
So they'll have a good story down the road. I'm sure it doesn't seem good now, but okay, so let's go into people who are kind of waiting to seek treatment, waiting till this all blows over. What is telehealth effective? What can we tell them?
You know, this has been an interesting time because sometimes you hear people talking about the silver linings, and as therapists, we try to help people look for what are the positives we can take away or what are the growth opportunities. And certainly we have been pleasantly surprised. So we are now having kids do show and tell with us. They're very excited to show us their rooms. We have increased insight into family dynamics by actually being in someone's home, and we can hear parents talking in the background. We have more access to do family sessions with everybody at home right now. Parents are loving not having to kind of bring the kids back and forth to the office. We're able to provide access to care to people in rural areas now that maybe didn't have the transportation. So we're finding a lot of silver linings in providing telehealth and actually increased insight and some surprising things that are actually making us more effective as therapists. We'll probably always keep some level of telehealth because it is effective. And you can imagine, Melanie, for a parent that's got more than one child and trying to run around, do after school activities, instead of being able to have to bring their teenager into the office, rather, sending them upstairs with a laptop to do their session might be actually far more convenient and allow us to provide more consistent care, which we know is part of the outcome studies. So when people commit to that weekly process, they're more likely to meet their goals and see the progress they want. And then once they've hit their goals, if they're willing to connect once a month for about a year after they've met their goals, we also know, and the research tells us, that people are more likely to maintain those positive outcomes and continue to grow and have a better quality of life. And so if we can remove any barriers, whether that's, gas, transportation, convenience, take some pressure off of parents and all that they have to do for their kids, we think that telehealth might be an amazing solution for that, and that the outcomes are going to be even better in outpatient care when we can do that. So I think it's something, not only is the efficacy there, but there are certain patients who benefit, I think, even more. We've also heard that people are super comfortable in their homes, so they're not having to go into someone else's office. They're, lounging in their room. They're in their comfy beanbag chairs. They're with their stuffed animals. So or finding all those cozy objects at home, or even blankets are really nice to have when they're talking about things that might be difficult emotionally. They have those soothing objects right there that are comfortable and familiar. So we're in a process now, kind of regrouping, and we think that we'll always keep it as a service to our families, because we find that for certain families and situations, it's far more beneficial than having them come back into the office. So this has been a huge silver lining for us to not only understand, hey, telehealth is working and it's valid and it's research proven, but that there's all kinds of benefits to families that we hadn't even thought of before we did this. So it's been a great learning curve for us. It's been a great process, and we hope to continue to fine tune that to where we always felt like we were doing individualized treatment plans, but now when someone presents to us, we're going to be able to tailor their treatment plan to exactly what location they want to be seen at in the future. So that's exciting.
Yeah, I think I've heard that over and over. And us having a teen mental health program, the family systems is the most important part. And for their recovery, it's, the aftercare, and to be able to be in the middle of it. And I have, 2 little ones and my husband, it's like you learn about the family systems right away. So they can talk to you, they're experiencing this and they're working with you in the moment, in the present moment. And I think that's like so powerful.
Yeah, it's huge.
Yeah. So, well, thank you for giving us this information. I hope you come back. I mean, there's so much we can talk about. Should I make these Facebook Lives longer? I don't know. But
yeah,
I'm sorry.
I'm grateful for you to be willing to get the message out there that telehealth is available and it's working, and hopefully it reduces people's willingness to be hesitant about it, and increases their willingness rather to reach out and to get support. So
yeah,
thank you so much for doing this today.
Oh my gosh, my pleasure. Yeah, reaching out now is the best time. So before we go, I just wanted to let you know that our next Facebook Live is with Deandra Medina, and she's our program director for our Del Mar Residential Eating Disorder Program. It's on April 29th at noon, and the topic is anxiety and isolation, using mindfulness when you are at home alone. It's a good one. And finally, a reminder that May is Mental Health Month. So we're going to be doing a lot around mental health awareness, and the theme is actually tools to thrive. So Kara, I had asked Kara if she could maybe give everyone one little tool or coping skill to put in their little toolbox.
Yes, so one that we use for mood regulation that's quick, easy, accessible to everyone is actually when you feel either your anxiety or your mood start to escalate, to stop and focus on counting. So depending on the age of the child or teenager, it might be a higher number that you're going to count to, and then actually try to count backwards. So if you're 7 years old, counting to 50 might work. If you're a teenager, an adult, you might want to count to 100 and then count backwards. And if you give yourself that counting opportunity before you react to that emotion, you're going to be thinking a lot more clearly by the time you respond. And we want to get into response over reaction. So counting is something we can all do to help de-escalate ourselves at any time.
That is perfect. And you can do that anytime, any moment. You don't need anything except knowing how to count. So that's a good one. Yeah. Okay, well, thank you so much for your time. And we'll see you guys again soon. Have a great day, everybody.